Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit consumer center organization committed to fulfilling the health and residential needs of the people in the community we serve. I'm your host, Jenny Sutherland. Well, hello, Emily. Well, hello, Emily. It's so nice to have you back with me again.
That was really impressive.
Ta-da-ta-ta.
That's really impressive.
For those of you who don't know, I'm a big fan of Hello, Dolly, and a big fan of Emily Uguccioni.
Well, we're a big fan of you, too.
Thanks for coming on the show, all the way from Linda Manor Assisted Living in Leeds, Massachusetts, where the jokes are free and the good times keep on rolling.
That's right. That's what we're all about.
That's exactly what you're all about. But I'm all about having you on the show. And I just want to be out there with everybody. We get a little silly together.
It's just something that tends to happen, yes.
It tends to happen.
Yes.
The last time you were on, we had Flat Stanley.
Yes.
From a Bennington, Vermont,
yes.
5th grade class. We don't have Flat Stanley today.
No.
Other times we have debated who has a, I want to say, hipper, groovier,
snappier dresser boss.
Yes. Your boss or my boss. The debate continues. A little shout out to my boss. Hi, Lisa. Want to shout out to Al?
Hi, Al.
Hi, Al. We just debate about you. And we're doing it on a TV show now. But the fight will continue another day. I asked you to come on because something pretty neat just happened to you.
Yes.
And as a modest person, I know I'm putting you on the spot, yes, because I'm giving you more recognition about this. So you were recognized this year as being one of the top care providers by BusinessWest. And I do have right here my copy of BusinessWest with a pretty lengthy article about you.
Yes.
And some pretty snappy pictures of you.
Yes.
Did you like that process?
It was really I felt like royalty.
Because you were getting pictures
yes.
taken, people were questioning you.
Yes, there was a lot of interviews. Yes.
And I want to say, from myself and behalf of Berkshire Healthcare Systems, congratulations on winning that award. So can you tell us a little bit about the award?
Sure. So BusinessWest and Healthcare News, which is based out of Western Massachusetts, this is their 3rd annual recognition program for healthcare heroes.
Yep.
And they do it in 7 different categories, from an emerging leader to health and wellness administrator to community provider of the year, and they recognize people that are making contributions to the community in the healthcare industry.
So you were nominated.
Yes.
Do you know how you were nominated?
Yes, they didn't want to tell me, but my staff, who actually did nominate me, spill the beans.
Oh,
yes.
I've seen them spill beans about other things in the past.
Yes, so
they get very excited.
They did, and so actually some folks, the scheduler actually nominated me. She wrote the letter, and then apparently solicited information from the other departments about my contributions.
So, I think it's great you won the award, clearly. And not everybody there's a handful of people. But I think it's even greater that your staff nominated you for that. So I would think that is as big of a deal to you.
It meant so much to me. And some of the things that they had written that they did share with me, and some of it was quoted in the article, was really touching that they wanted to speak about some of the things that they think that I do and what that means to Linda Manor.
And it is a great article. So I'm going to ask you, your parents were pretty proud about this, huh?
They were, for sure. For sure. My mom wants to get it framed, the article. It's like when you have a restaurant review that's really good and they frame it.
I think it's great for our organization to have a leader that was recognized. Now, how long have you been with Berkshire?
4 years.
4 years. I feel like we've worked together for, all of the 4 years, clearly.
Yes.
But, you're just a perfect fit with our organization.
Well, thank you.
You represent Berkshire for me.
Thank you. I feel like I've always been here, and I've never worked for an organization like this one that, really prioritizes the mission and the vision and the core values. They're not just something that hangs on a wall because we have to for compliance.
No.
It really means something to everyone that works there.
Yeah. So out there at Linda Manor Assisted Living, on the Linda Manor Care Campus.
Yes.
What kind of a place do you have there at Linda Manor Assisted Living?
It's an award-winning campus of care. So we have from housing, and we meet all your healthcare needs. So we go from senior housing all the way to short-term rehab, long-term care, and dementia-specific programs also.
And if folks were interested in taking a tour and seeing what you have,
we have a great website, campus of care website,
okay.
lindamanor.org.
Okay.
And you can also reach out to the admissions staff there
okay.
at the assisted living and the nursing home,
all
which
right.
would they'd love to have you for a tour.
Yeah, and I know for sure people can tour anytime they want.
Absolutely.
In the evenings, on the weekends. And you are quite a busy campus. You have a lot of community events,
yes.
a lot of education things. So folks might be interested in getting their name put on a list. So if you're doing a presentation about taking care of caregivers mm-hmm. or dementia care, they could be invited to those things.
Absolutely. We run those all year long.
I think, do you have one coming up? I think you have one.
We do, about what the benefits of assisted living and what assisted living is.
Yeah, because some people don't understand
right.
the difference.
Right.
All right. Well, I'm going to thank you for coming on. I'm going to congratulate you again for winning the award, and also super happy that we are colleagues with Berkshire Healthcare System.
It's an honor to work with you.
Oh. All right, we're going to take a quick break. When we come back, June Green from Hospice Care in the Berkshires. Back in a minute.
Nestled in the center of the picturesque Berkshires of western Massachusetts, Hospice Care in the Berkshires has served the county for more than 30 years. Hospice Care in the Berkshires is a proud affiliate of Berkshire Healthcare, the state's largest nonprofit provider of nursing, rehabilitation, and senior housing in Massachusetts. Berkshire Healthcare is committed to fulfilling the health and residential needs of the people in the communities we serve. Hospice Care in the Berkshires offers comfort, compassion, and the emotional and spiritual support families and patients value when faced with life-limiting illness.
When my mother-in-law was diagnosed with terminal cancer, we had hospice come directly to our home. It's where she resided and wanted to have her care done. It was a tough time for the family because it was a shock to find out the limited amount of time that she had. But when we started working with hospice, they came in and worked with us wonderfully. They helped us navigate through all the administrative tasks. They told us about all the services that were available to both the patient and the family, the social workers, the home aides, the nurses, and really helped us get through this tough time.
Our caring, dedicated, and experienced team of professionals supports patients and families where they live, whether it's at home, a nursing home, or assisted and independent living facilities. This team includes hospice-trained physicians, hospice nurses, family counselors, spiritual counselors, and hospice aides.
Oftentimes people ask us, why do you work for hospice? Why would you do this? Why do you work with dying patients? And I think most of the people on our team would say that it's an honor to work with people at end of life. It's an honor to try to support families and patients through end of life, to make sure that they are cared for with dignity, that they die peacefully, that their families are supported through that process. It's our goal to make it even a little bit better if we can. We can't change the outcome, but to be there and to support families through the process and patients through the process in every aspect is really important.
And we do try to support both the physician and the patient and family at this time in their lives in whatever location that patient and family want to be.
And I just knew that when I retired, I wanted to be part of helping people that were dying and didn't have someone to be there to support them. I knew that that's something I wanted to do.
Our incredible team of hospice-trained volunteers are instrumental to the support we offer families. Our team of over 100 volunteers helps with transportation to appointments, running errands, and respite for the caregivers.
When you know that you can make a difference and that person is secure and feels not as scared because they have someone to sit there to hold their hand. I just can't tell you you just feel like you're floating on a cloud when you leave. And to be there when they actually die and to know that you've made it easier for them, you just can't explain that.
Hospice Care in the Berkshires is grateful to the many people who make donations. All the funds raised support the agency's community programs and services, an integral part of how we serve Berkshire County.
Bereavement services at Hospice Care in the Berkshires are funded through philanthropic dollars from the community, and that would include donations, memorial donations, and also community events that we have, such as our gala, our remembrance walk that we have every September, and that allows us to provide bereavement services to all members of the community, not just folks who were hospice patients' families.
I would definitely recommend Hospice Care in the Berkshires to other families. Again, the range of services was wonderful. In fact, I love the organization so much that I now volunteer and help other families who are going through it.
Choosing hospice isn't about giving up on life. It's about choosing the support needed in order to live a full life right now. For more information about how hospice care in the Berkshires can help, call us at 413-443-2994.
Welcome back to InfoSource. Hello, June Green.
Hello, Jenny Sutherland.
I promised people that you'd be on next, and here you are. When we were switching over guests, I was like, we should make a June Green action figure. That would be awesome.
I don't know about that.
That's what I'm going to do this afternoon, work on an action figure. And like do some tripped out like mobile, like I don't know what, but it'll be cool. It'll be exciting. Or maybe I won't because I'm not crafty at all. It'll be like 2 buttons and a paper towel roll.
Right.
Anyway, June Green from Hospice Care in the Berkshires, thanks for coming on.
Always happy to be on the show. I enjoy taping the shows.
You are probably the easiest guest ever, so thank you.
That's because I'm a social worker and we like to talk a lot.
Yes, and you love your work and you're passionate about it and all the things a host wants, and you don't just go, yes, no. You just came back from vacation, and
Yes,
I want
I
to talk about that really quick. Where did you go? Why? And you are like such a good person.
I went to Haiti. It was my second trip to Haiti with an organization called Remote Area Medical. My son works for it's a not-for-profit, and they provide free medical, dental, and vision clinics across the country, and they do some out-of-the-country clinics as well. So it was the 5th time going to Haiti. And we provided care for about 800 individuals during the time I was there in 95-degree heat. It was a great trip. Met a lot of great people, similar to what I do for hospice, you know.
Yeah. And I had talked with you a while back, and you were looking forward to this, and it's amazing, 800 people. So
yeah,
thank you for doing that.
It was really good. Yeah, I totally enjoy it. Very different from what I do at hospice, and yeah, I learned totally useless Creole words because I was in charge of helping at the pharmacy.
Right.
So,
well, yeah, you do good work and you do good vacations, and I'm not going to tell you about my vacation because it seems so meaningless now, but thank you for doing that. And the work that you do at Hospice Care in the Berkshires, which is what, June?
Hospice Care in the Berkshires is a not-for-profit hospice, and we serve all of Berkshire County. We've been over 35 years in Berkshire County, and we're happy to provide services to people in all of the skilled nursing facilities in the area. We have patients at home, assisted living, group homes. We're all over Berkshire County.
That is true. You are all over. You also offer care for younger people, too.
Yes, we do. That's near and dear to my heart.
It's dear to my heart. That's where I like to go there with you. This is important work.
So we have a program that we operate that we're fortunate to have a contract with the Department of Public Health, where we provide a program called Pediatric Palliative Care. And big news in that program, we just got another $100,000 increase from the Massachusetts governor approved it, and it just went through the budget process. So we currently, last time I spoke to you, I think we had maybe 15 or 16 kids in the program. Yeah. Currently, I have 39 kids in that program.
Well, that's what I wanted to ask, and that's why I wanted to bring this up, because you came on a while ago, and we talked about it, that people don't understand that is out there. And so I am happy to hear that more people are aware of what's being offered and that you have the funding to do it. So let's talk about, like, within that, what services are available to the child and their family.
So I always like to, when I talk about the program, it's nice to talk about hospice and pediatric palliative care, kind of comparing the two, because hospice is for people who have a prognosis of 6 months or less. Yep. Pediatric palliative care is for children from birth to age 19 who have a life-limiting illness. So some of the kids in our program are terminally ill, but the majority of them have a life-limiting illness. So it's expected with their normal disease process, they might only live into their 20s or their 50s or 60s, because that's a life-limiting lifespan. So terminally ill compared to life-limiting illnesses. Hospice is primarily funded through Medicare, whereas the PPC program is funded through the Department of Public Health, and it's a budget line in the state budget in Massachusetts. So two very different things. Both are able to offer nursing. Nursing in the hospice world is hands-on nursing and help with pain and symptom management and very direct care, talking to the doctors and getting medications ordered and doing things of that nature. Hospice in the pediatric nursing in the pediatric palliative care world is consultative nursing, because the majority of our children get their care at Boston Children's or at Bay State Medical Center. So the nurse is helping them to prepare for visits, helping them for in between the visits, answering questions and helping them to negotiate things like what services a child gets at school and working on IEP things. So the nurses do a very different role, but both get nursing. And then both get social work, and social work is very similar in terms of providing emotional support and education about whatever's going on with disease process and helping to connect them with resources. So they do that. Both programs have integrative therapies. We have art therapists now. I'm so excited. We have
and art, music was big before.
Art, music, and massage. And in the hospice world, that's not covered under the Medicare benefit, but we provide that through our very generous donors. Our philanthropic dollars are used for that in the hospice world. In the PPC world, that's actually a budget line, and we pay for it directly out of the budget. It's a major component of the program. So we can do both. Both programs can do respite. In the hospice world, we can pay for 5 days of respite in a skilled nursing facility. If a caregiver becomes sick or unable to provide care, a patient could go for 5 days to a skilled nursing facility, and hospice pays for that under the Medicare benefit. In the PPC world, the families, if they need a break, I mean, these kids have very significant health issues, and it's very overwhelming for those families. And, sometimes it'd be nice for mom just to be able to get her hair done, get the groceries, have a little couple time. So we can reimburse the families for up to 40 hours a year where they pay someone to care for their child while they're doing something else, and the program can fund that. So very different programs in many ways, but both focused on quality of life. It's about, in the hospice world, I always say to people, it's not time to curl up and die. It's time to think about what are the things you want to accomplish in the time you have left, and it's about us making sure that you have the best quality of life with your symptoms managed. So, and both programs focus on that kind of quality of life stuff. So that's what we do.
And you mentioned art therapy, and I chimed in about the music therapy, and that's, again, offering these kids the opportunity. I keep thinking about one of the stories you first told me about, the little guy who just wanted to drum. And
the kids just love it. I mean, we have one of our kids, he's really not able to use his hands functionally. So Emily Chin, our music therapist, goes in and she has bells that she puts on his feet. And he goes along with the music with his feet. He's using the bells with his feet. And I just love watching music therapy because it's so wonderful. Emily does a fantastic job for us. And we do the other thing in PPC world, we're able to provide music and massage and those things for everybody in the family. So if mom's stressed out, I can send a massage therapist to give mom a massage. In the hospice world, we're limited to that being directed at patients only. But PPC, we really work with the whole family in terms of being able to provide some of those integrative therapies, especially art therapy for the kids, the siblings, because it's tough. Their life is very restricted by the nature of having a very significantly ill family members. So so support for them about their feelings around that.
Yeah.
So we do that as a part of that program.
Yeah, I think again, I'm so happy we offer this because there is a need, but this whole family support and thinking about the siblings going through this and the stressors on the parents or guardians and them getting support and that respite where, and you've mentioned some of these people are sick themselves.
Yeah, it's not uncommon that we have family members who sometimes have the same disease that their child has, or other things, because and I think some of it is related to the stress that they're under. That some of them have health issues due to the extreme stress of having a child with a fragile child with medically complex issues going on. It's very stressful for them. So, like I said, it's nice that we can provide those supports. And the other thing that's changed is we're offering more family events now.
Oh, cool.
So you love this.
Oh, yeah, come on.
And honestly, Jenny, I might recruit you for this one.
Yeah, I will.
We have, we're going to be doing reverse trick or treat, which we did last year for the first time. And reverse trick or treat is our staff get dressed up in costume and we go, our kids can't do traditional trick or treat.
It's too much.
It's not realistic. And some of them are immune compromised. So we dress up, all the staff, and we get all this candy, and we go to the houses and we give the child a bucket for their candy, and we put candy in their buckets. And those who can't.
When is this?
We've got 3 nights we're doing it in October, and of course I can't remember the exact dates right now, but I'll give them to you.
But I'm writing this down.
But we're doing 3 different nights that you can come any of those nights, and we go around, and it was a huge hit last year. One of our kids had a costume where he's in a wheelchair, right? And he's a fabulous kid. I just love this little boy. And he had a costume they got online where he was dressed up like Mario, the race car driver.
Yeah.
So his wheelchair was transformed into a race car. He had a little mustache on.
Oh, that's awesome.
And he had the little cap and everything.
Oh, my God.
And he was ready for us when we came.
I am so in with this.
So it was a lot of fun, So we're able to offer these activities to help these kids have some of those normal childhood memories in the twists that we need to do because of the limitations that some of them have and the restrictions on what they can do. So we're doing reverse trick or treat in October. Then we're going to be doing a tree for the Festival of Trees once again. This year's theme is heroes, those who inspire us. So hospice will be doing a tree for the Festival of Trees, and the PPC program, the Pediatric Palliative Care Program, will do its own tree. And what we did last year, we're going to do again, where the museum, Berkshire Museum, is fabulous. They gave us the opportunity to come a little early before the museum opens for some of the kids who are immune compromised and can't be in public.
Oh, that's awesome.
And,
so they could participate.
And all the kids could come so they could see the Festival of Trees, and then they gave us a room where we had a little holiday party and Santa Claus and pictures and pizza and just had some fun with the kids. It's nice for the families to get an opportunity to talk to other families that are struggling with similar issues and just make that connection with each other. So we're going to be doing that again at December 14th. We'll be doing that, and I'd love to have you come to those events.
Well, I am also participating in the Christmas tree thing with one of our other affiliates, so I can support you guys as well. But I am really, really digging on this reverse trigger tree. I think this is ingenious, personally.
It was a lot of fun. We stole the idea from one of the other pediatric palliative care programs in Springfield.
I'm going to steal this idea from you, and
it was really a big hit. So we're happy because we have funding now to do some family events. So throughout the year, we just had a big picnic at the Lenox Community Center, which again gave us a really nice discount there. We did had a picnic there and had a music therapist, and the kids were getting their face painting and tattoos. That I learned now they like to get little fake tattoos, so they were doing the tattoos. And so we just had that event, so there'll be a lot of exciting. And of course, we're doing Caring for Children again this year. So we're going to be sponsoring kids through Caring for Children, which is a wonderful organization. I really encourage people to donate to it, to become a sponsor. It's frankccc.com. It's the Rosemary and Frank Iovino Caring for Children Foundation. They provide gifts for all the children in the household. They deal with children who have medically complex issues, medically fragile children, where there's a financial need, which is always the case with these kids because it's so expensive. It goes along with it, yeah. Our office will be sponsoring some kids again this year. And last year we sponsored, between the kids in our program and other children I became aware of in the Berkshire County community, we sponsored, there were about 75 kids sponsored. This year I'm expecting over 100.
Yeah. This is a wonderful, wonderful thing in the community. This family and the family that continues this on in the parent's name is incredible. Yeah. The amount that they give and we've had them on before.
Yes. John came to visit one time.
Yeah.
So we're really looking. That program started in the Boston area, and it's still kind of heavy with the sponsorship in the Boston area. And we're really trying to encourage more Berkshire County organizations to get involved. Like we have had a law office from an Albany area that's sponsoring some of our kids, but getting more of the Berkshire County community involved in sponsoring the kids that are in our community.
So just again, this is an organization that collects and gives out to children and their families.
Yes, so every child in the household gets a gift. They ensure that every child gets, they focus on clothing because they were aware originally that there was such a need for, that a lot of organizations do toys, but not many do clothing, and particularly in our climate, there's a great need for winter clothing. So the sponsors do a minimum of $150 per child of new clothing, and then we give them a wish list of other things that the kids might like, and they could add on and fulfill that. So sometimes multiple people, go together to sponsor a child. All the children in the household. So it's, because you can't have that be, the sick child gets this big pile of toys and the other kids are kind of sitting there saying, what about me? Yeah. So they sponsor every child in the household. Last year we had a family that sponsored another family, and they actually even bought a Christmas tree because they had asked me, and this family did not have a tree. And so they got a Christmas tree and the decorations and everything. So we not only delivered gifts, we completely set up Christmas for that family.
But what a wonderful thing to do with them and for them. And that's a great gift.
These people really struggle financially, and sometimes Christmas isn't going to happen. Yeah. So it's just an opportunity for people to really support these families in a meaningful way, and the families always love it, and it's great because the parents, you give the list, but you don't know exactly what got bought off the list, and the gifts are brought to them totally wrapped up in a garbage bag so that they can hide it from the kids, the gifts, until whatever time they want to give those out. And I do want to recognize, too, that they also observe, families, if it's a Jewish family, other traditions, they will wrap the gifts and do things along with that tradition in whatever way is appropriate. So it's a wonderful charity. John Iovino lives here in Berkshire County.
He's just a great guy.
He's just great. He started the program a long time ago, and last year they served over 500 children.
That's amazing.
So we're excited. The hospice staff are going to be sponsoring kids again this year, and like I said, I'm also looking for, wanting to hear about other children in the area who might not be in our program, who might benefit, because we'll help them out as well. That's why it's
important, and I'm always glad that you're willing to come on, especially about this to me. I want to get the information about this service that you offer and also your upcoming events. I'm going to do the trick or treat. That I'm down with that.
That's a lot of fun. It is.
So please, I'm going to ask you to email me the dates.
I will
do
dates.
That. But if folks want to reach out to you to get more information about any of your hospice care.
Hospice care in the Berkshires, the phone number for us is 413-443-2994. And it's hospice care in the Berkshires, and you just call that number, and I'm only June in the office. They can find me pretty easily.
Yeah, paging June Green. June Green.
And really, we're just excited and really enjoy the opportunity we have to serve the county and with the PPC program as well as hospice. So look forward.
Thank you for doing what you do.
Thank you.
I'm very excited about all this stuff.
I had some good stuff to tell you about.
You did. So thanks again, and thank you for watching. I want to remind you that InfoSource is a presentation of Berkshire Healthcare System. Until next time, I wish you good health and good life. Bye for now.